The lesson objectives are to understand the background of COVID-19, cover what the effectiveness of the vaccine is, how it works, and how long it takes to work, and identify what being vaccinated could mean for the population. First up, we're going to be talking about the background of COVID-19. COVID-19 actually comes from the human coronavirus, which is most commonly known as the common cold. However, because of the different strands and the different makeups, COVID-19 is significantly different from the common cold. It emerged in Wuhan, China in December 2019, which is where the 19 comes from in the name. Also, with the name COVID-19, according to the CDC, CO stands for corona, VI stands for virus, and D stands for disease. Although the source of COVID-19 is unknown by scientists, they assume that it originated from bats or some other type of animal. We all know that because of COVID-19, it spread worldwide and caused a pandemic, which also caused countries to go into lockdown. And when it was safe to go out again, precautions were put in place to keep people from spreading the virus to each other. And those precautions are still currently in place today, as we are slowly but surely getting the vaccine out and distributed.
Studies have shown that COVID-19 vaccines are effective at keeping you from getting COVID-19 and will also help keep you from getting seriously ill even if you did get COVID-19. It works by teaching our immune system how to fight off the virus. COVID-19 vaccines teach our immune systems how to recognize and fight the virus that caused COVID-19. It typically takes 2 weeks after vaccination for the body to build protection or immunity against the virus that causes COVID-19. That means it is possible a person could still get COVID-19 before or just after vaccination and then get sick because the vaccine did not have enough time to provide protection. People are considered fully protected 2 weeks after their second dose of the Pfizer or Moderna vaccine, or 2 weeks after the single-dose Johnson & Janssen COVID vaccine. Scientists are still trying to understand how well this vaccine can stop the spread, and they are still unsure at how long it can protect us.
Life after vaccination. You are able to reconnect with family and friends. Once you're fully vaccinated and have waited the recommended period to allow your body to build its immunity, you are able to reconnect with family and friends who have either been vaccinated or who are at low risk for infection without wearing a mask. This is the first step in reconnecting with person-to-person interactions. Eventually, we will be able to ditch the mask. This is the final step in the effort to getting back to a more normal way of life. Guidelines will not be in place forever, so for us to get rid of masks and social distancing and limitations, vaccines need to be put into place so that we can go back to living a life where coronavirus isn't spreading rapidly. There will be no need to quarantine after an exposure. Once you're fully vaccinated, you do not need to quarantine after an exposure to a positive test if you're not experiencing any symptoms. Lastly, there will be more lenience in what you can do with others as well as the guidelines. Once you are fully vaccinated and your body has built its immunity, you are able to do a little more with your friends and family. You can remain unmasked around those who are fully vaccinated as well as those who are at low risk for infection. While you should still be following guidelines, you do not have to social distance around those who are fully vaccinated. You should still wear a mask and social distance out in public places and around large crowds of people who are not vaccinated to stop the spread.
The first assessment question: what is the source or cause of COVID-19? Is it A, rats, B, insects such as mosquitoes, C, the virus was human created, or D, the source or cause is not known but likely from an animal such as bats? The correct answer is D, the source or cause is not known but likely from an animal such as bats.
How long does it take for your body to build an immunity against the virus that causes COVID-19? 4 days, 2 weeks, 1 month, or immediately after getting vaccinated? The answer is 2 weeks.
What are the guidelines for wearing a mask after being fully vaccinated? A. You're allowed to go unmasked everywhere. B. You can remain unmasked around other vaccinated individuals. C. You must wear a mask whether you are vaccinated or not. And D. You can go unmasked while still being social distanced. The correct answer is B. You can remain unmasked around other vaccinated individuals.